Okay, hello everyone. Assalamu alaikum. This is Sharifa Liaish. Inshallah, in this video, we'll explain how to interpret a CTG on a CTG strip. First thing, I'd like to mention that reading a CTG is easier than you think. I know it looks intimidating and weird at first, but once you take it step by step, it will all make sense, inshallah. Okay, so as we know, there are multiple methods for fetal assessment and monitoring. We can check the fetal quickening in the second trimester, or we can do an auscultation to listen to the fetal heart, but this is not an old method that it's not used in nowadays. We can also record the fetal heart rate and the maternal uterine contractions by the CTG machine that we're going to talk about today. So what does the CTG stands for? It stands for cardio, for monitoring the heart rate of the baby, and also TOCO, because we're monitoring the contractions of the uterus, and graphy because it's put on a graph. How does the CTG machine work? We should know that the CTG machine is a non-invasive electronic fetal monitoring machine, and it's used mostly to assess the high-risk pregnancies. It can be measured either externally, which has two parts, an ultrasound transducer for the fetal heart detection, and also a TOCO transducer that is put on the maternal abdomen for measuring the uterine contractions. And it can also be measured internally, but that's invasive and requires the membranes to be ruptured, and it's used during labor. And also includes two parts as well, the fetal scalp electrode for fetal heart detection and the intrauterine pressure catheter for uterine contractions. Okay, so when can we start using the CTG? It is initiated at 28th weeks, because that's when the neurological maturity begins and enables us to detect these movements of the fetus. Okay, so let's start with CTG interpretation. There are 5 important things that we need to look at in the CTG strip while interpreting. We can use the mnemonic Dr. C. Bravado. So first of all, we need to define the risk. And these risks could include a high maternal age or a low maternal age less than 16 or more than 35. Chronic diseases like hypertension, diabetes, cardiovascular diseases, renal diseases, thyroid or asthma. It could also be due to preeclampsia, Rh isoimmunization, history of stillbirth or preterm labor, history of C-section, post-term pregnancy, or also oxytocin induction of labor, because hyperstimulation of labor by oxytocin is one of the high-risk factors. Also, multiple gestations, previous cervical incompetence or congenital malformations, intrauterine growth restriction, and also the absence of prenatal care. Yes, this is very important. Came as an MCQ, by the way. Smoking or drug abuse. Okay, so that's the first thing, defining the risk. Next, we need to look for the uterine contractions. BR stands for the baseline rate or the heart rate of the fetus. A for the accelerations, VA for the variability of the heart rate. D, we're looking for any decelerations in the heart rate. And O, which is the most important step, we're going to look for the overall impression to decide which category this patient lies on, so we can predict the management. Okay, so this is our mnemonic for today that we're going to follow.